Developmental perspective on death. Death can occur at any point in the human lifespan. Death can occur during prenatal development or during or just after birth through miscarriages and stillbirths. In infancy, the leading cause of death is sudden infant death syndrome. In childhood, death most often happens because of accidents such as car accidents, drowning, poisoning, fire, or falls, or from illness. Compared to children, death in adolescence is more likely to happen because of motor vehicle accidents, suicide, and homicide. A lot of motor vehicle deaths among adolescents also involve alcohol. Many younger and older adults die of illnesses such as heart disease and cancer, but younger adults are more likely to die from accidents compared to older adults. Although very young children may have some difficulty grasping the concept of death, by middle childhood, most kids have a realistic understanding of it. They understand that it's irreversible and biological. Children's views of death and their experiences with death vary with cultures and contexts. As mentioned before, U.S. children aren't exposed to death as early or as often as children in some cultures. Parents try to shield them by doing things such as replacing the family's deceased pet gerbil with a similar-looking one so that the child doesn't realize it died. Or they might say that someone went away or went to heaven, which a very young child might interpret as the person simply going on a trip from which they might soon return. When trying to explain to a young child that the death has occurred, explain it in simple biological terms. You don't need an elaborate explanation. They just need to know that they are loved and they haven't been abandoned. Be sensitive and sympathetic to them, and encourage them to express their feelings and ideas. Awareness of death increases in middle adulthood, and middle-aged adults actually fear death more than both younger and older adults do. Older adults have a more direct experience with death as their friends and relatives have become ill and died. They discuss death more often in conversation and are forced to examine the meanings of life and death more frequently than younger adults. Younger adults are more likely to feel cheated out of the opportunity to do things with their lives if they find out that they're dying, whereas older adults feel like death is more appropriate by their age, and they are less likely to have unfinished business like children who are still growing up or work-related projects that still need to be completed. What are some of the risk factors that place people at risk for suicide? They include serious physical illness, mental disorders, feelings of hopelessness, social isolation, failure in school and work, loss of loved ones, serious financial difficulties, drug use, and prior suicide attempt. Suicide behavior is rare in children, but escalates in adolescence and increases further in emerging adulthood. Suicide is the third leading cause of death among 10 to 19-year-olds in the U.S., but suicide rates in adolescents have declined somewhat since their peak in the 90s. Although a suicide threat should always be taken seriously, far more adolescents contemplate it or attempt it unsuccessfully than actually commit it. Among adults, however, suicide rates are increasing. The number of deaths from suicide now surpasses the number of deaths from car crashes. There are gender differences in suicide behavior. Women are 3 times more likely to attempt suicide, but men are 4 times more likely to actually commit suicide. Demographically, the person most likely to commit suicide is an older adult male who lives alone, has lost his spouse, and is experiencing failing health. One contributing factor to suicide is the perception that one is a burden to others. So some things that help to protect a person from the likelihood of suicide are a supportive network of family and friends, good emotional control skills, and comfort from religion. So what do you do and what do you not do when you think someone is likely to attempt suicide? Some things you should do. One is ask direct, straightforward questions in a calm manner, such as, are you thinking about hurting yourself? I guarantee that if they weren't, you're not going to put the idea in their head. Assess the seriousness of the suicidal intent by asking questions about feelings, important relationships, who else the person has talked with, and the amount of thought given to the means to be used. If a gun, pills, a rope, or other means have been obtained and a precise plan has been developed, clearly the situation is dangerous. Stay with the person until help arrives. Be a good listener and be very supportive without being falsely reassuring. And try to persuade the person to obtain professional help and assist him or her in getting this help. Some things not to do. Don't ignore the warning signs. Do not refuse to talk about suicide if a person approaches you about it. Do not react with humor, disapproval, or repulsion. Do not give false assurances by saying things such as, everything is going to be okay. Also, do not give out simple answers or platitudes such as, you have everything to be thankful for. And do not abandon the individual after the crisis has passed or after professional help has commenced. This is a complicated problem and it requires ongoing support.